Hello, everyone, and welcome to Compassionate Care 101. This module is an introduction to compassionate care for persons with Alzheimer's disease and related dementias. I'm Dr. Sam Cotton with the University of Louisville Traeger Institute. This particular module will really serve as the foundation for your training and work in compassionate caregiving. At the end of this module, you'll be able to understand the unique challenges of providing care to a person with Alzheimer's disease and related dementias. You'll be able to demonstrate the ability to communicate effectively and compassionately with persons with Alzheimer's disease and other types of dementias using things like nonverbal cues and simplified language to facilitate trust and understanding. And you'll also be able to apply person-centered care principles by tailoring individual care plans, really considering that person's unique history, their preferences, what matters most to them, and their cognitive abilities to promote a sense of dignity and autonomy. So we're going to start today's discussion by really doing a broad overview of dementia and Alzheimer's disease and what you might need to know in order to provide effective and compassionate care to those who you are working with. Now, often there's some confusion when we start talking about dementia and Alzheimer's disease because often we use these words interchangeably. So I'm going to start by talking about dementia. So dementia is really that broad term that we often use to describe a range of cognitive impairments and some of those associated symptoms that often interfere with a person's ability to perform everyday activities and functions. When we start talking about dementia, we're really talking about a cluster of symptoms, and there are different types of dementia. So you might hear individuals talk about dementia with Lewy bodies, frontal temporal lobe dementia, vascular dementia, Alzheimer's disease. All of these are various forms of dementia. And what we see across all of these different conditions is really this focus on memory loss. So we notice that individuals often cannot remember things that have happened, whether it be memories from a long time ago or even more recent things that have occurred in their life. We often see that they have impaired cognitive function, meaning that often reasoning and logic is impaired, dealing with complex situations or dealing with issues related to even being able to do things in their day-to-day life, like balancing a checkbook or managing the financial aspects of their life. We often see that individuals have impaired language, meaning that often they're doing word retrieval, they can't remember specific words, or they might have issues in terms of communicating their needs or explaining what's going on. This is especially true for a lot of individuals with dementia who are in a large group setting. It might be hard for them to track the conversation and quite understand what's going on. For some individuals with dementia, we see disorientation and confusion, so they might not be oriented to place or time or understand where they're at. With a lot of individuals with dementia, we often see changes in personality and changes in behavior. So things like agitation, aggression, frustration, individuals dealing with things like delusions or hallucinations, or even the manifestation of repetitive behaviors that they did not have previously. And then we also see a loss of motor skills, meaning for some individuals, we see that shuffling gait, issues with mobility and with falls risk as well. And in general, I want you to understand that dementia is really characterized by this decline in cognitive abilities. So the memory piece is a huge part of it. When we're talking about dementia, we often focus in only on that memory loss piece because it's such a huge piece of the puzzle for most individuals and their caregivers. But in general, we often see impairments in terms of thinking, reasoning, that language piece, that communication piece, and the ability to perform day-to-day activities or tasks. And as a result of that, because of all of these things that are going on with the individual, we see that dementia often affects a person's behavior and personality as well. So I want to make it clear to you as well that Alzheimer's disease is one type of dementia. Often you might hear people use those words kind of interchangeably. I think this happens for a multitude of reasons. One, it is probably because Alzheimer's disease is one type, but it's also one of the most common causes of dementia. And so often people kind of equate the two. Alzheimer's disease is a progressive neurological disorder. It primarily does affect cognitive functioning, so things like memory, thinking, behavior. And at this juncture, we really don't know the exact cause of Alzheimer's disease, why some people develop it and other people don't. But it is believed to be a combination of a number of different things, including genetic, environmental, and lifestyle factors. We're not going to get so much into that today as part of this module, but I think it's important to understand that it is a combination of a number of these factors. What makes Alzheimer's disease different than other types of dementia is we know that there is an abnormal protein deposit in the brain that is also contributing to some of these challenges that an individual is having. And really what happens when you have this buildup of beta amyloid plaques and tau tangles, we see that that really causes cell death within the brain. And sometimes those missing connections is what tend to contribute to individuals having these challenges as they decline with the disease. And as a result of all these changes that a person is dealing with, they really require a lot of assistance as it relates to basic nursing care. So when we talk about basic nursing care, it's all of those things that we have to do with a person with Alzheimer's disease that's related to their activities of daily living. In your role, you might be doing some of this hands-on care with a person with Alzheimer's disease or another type of dementia. So things like helping them with food, helping with bathing, helping give them medications, helping with cleaning, with those general household tasks that need to happen every day, helping with dressing, getting ready for their day. And in some situations, really helping them with that general communication because their language and communication skills are impaired because of the disease. And I want to highlight that while we're going to be focusing on compassionate care, and I'm going to explain here in a moment what that means, I don't want to undermine basic nursing care because it is so important for the person with Alzheimer's disease and other types of dementias to receive that care because they're no longer able to provide care for themselves in those areas, those activities of daily living. It becomes so important for them to receive that hands-on care that you're providing to them. But in general, we want to also elevate this basic nursing care to also thinking about how we can incorporate compassionate care into the work that we're doing with the individuals that we're providing care to. Now that we've identified some of the basic care needs that individuals with Alzheimer's disease and other types of dementia often need support with, let's pivot now and focus on the behavioral health and emotional needs. It's really critical that we all understand the unique needs of persons with Alzheimer's disease and other types of dementias, particularly as it relates to these emotional needs that they often really struggle with and have challenges with. We know that persons with Alzheimer's disease often have complex behavioral health needs. These can be very challenging for the person providing care to them. These needs can be very different depending on the person, on the stage of the disease, on that person's unique circumstances. But in general, we know that there are a couple of areas where individuals with Alzheimer's disease and other types of dementia have some really unique needs. One being depression and anxiety. We know that Alzheimer's disease can lead to these two challenges for individuals. Persons with Alzheimer's disease and other types of dementias may feel overwhelmed by their surrounding, by interacting with others, including those providing care to them. They might have difficulty communicating and in general feel that loss of independence that they're dealing with. And so that culminating effect really contributes to significant challenges related to them feeling depressed, feeling anxious. We often know that individuals, because of that loss of independence that they might be dealing with, might become very resistant to care. They may resist care related tasks like taking a bath or grooming. Sometimes these different tasks cause a lot of stress and frustration for them, which again increases that anxiety or that depression that they might be feeling. Persons with Alzheimer's disease and other types of dementia also have those challenges related to language and communication. So they might not always be able to express themselves. They might not be able to effectively communicate that they're feeling sad, that they're feeling lonely, that they're feeling this sense of stress. And that can be overwhelming and frustrating for them. Also, individuals might have feelings of stress or agitation, that persistent feeling of disorientation or confusion might cause significant stress for the person with Alzheimer's disease. And once again, not being able to communicate all of that can be very, very challenging for individuals. Because of these complex behavioral health and emotional needs that a person with Alzheimer's disease and another type of dementia may have, we often see that in lieu of them being able to effectively communicate that to us as the person providing care to them, it might manifest in different ways. So we see sometimes that persons with Alzheimer's disease have issues related to anger or agitation or aggression, or in general, we might be able to just tell that they're generally frustrated by whatever basic care task that we're engaging with them on. We might see that individuals engage in repetitive behaviors. Often this is a soothing mechanism for them. They're trying to comfort themselves as it relates to trying to manage all of these various contexts that are going on around them. Additionally, due to a number of challenges related to their condition, they might be dealing with hallucinations, so seeing things that aren't necessarily there, and or delusional thinking, and not necessarily know how to express themselves. And so, in general, it's really important for us to pay attention to these three focus areas in our work with persons with Alzheimer's disease and other types of dementias. And these are not the only types of behaviors we see. They're just the most common ways that we see some of those things like anxiety, depression, that loss of independence, that isolation that they might be feeling often manifest in these ways. And this is where we bring in compassionate care. So once again, basic nursing care is really, really critical to the work that we're doing with persons with Alzheimer's disease and other types of dementias. However, completing those activities of daily living with an individual doesn't really get at some of these other challenges that they're dealing with. And so introducing compassionate care can really elevate that, those basic activities of daily living that we're doing. And as we go through the subsequent modules in this training, I think you'll see how you can apply some of these compassionate care tips in doing some of the basic care that you're providing to the person with Alzheimer's disease or other types of dementias. So what is compassionate care? Well, really underlining this idea of compassion and providing care to persons with Alzheimer's disease and other forms of dementia, it's really recognizing that suffering that person's going through, acknowledging that this is a particularly emotionally painful condition. A lot of times we focus mainly on, what it strips away from the individual, things like memory loss, things like thinking and cognition. But if we step back and really think about this particular condition and how it manifests for most individuals, underlining a lot of that is that suffering that person's going through. And I'm not just talking about the physical suffering as they lose some functioning across the board as it relates to being able to do those activities of daily living. It's also that emotional suffering that they're dealing with. And so we really want to think about ways we can provide care to help alleviate that suffering that person's dealing with. Really thinking through all of those different changes that person's going through, that loss of independence, and how can we better provide care to them to acknowledge all of this journey that they're going through related to their Alzheimer's disease or other form of dementia diagnosis that they're dealing with. So now we're going to take that idea of compassionate care and look at how we can apply that in the work that we're doing with persons with Alzheimer's disease and related dementias, really thinking through the why behind those behaviors. As we already have discussed, a lot of persons with Alzheimer's disease and other types of dementias often have very challenging behaviors that we're having to navigate, like aggression, like agitation, repetitive behaviors, so on and so forth. So taking that step back and thinking about how we respond to those behaviors as they're presented by the person and how we can better manage these challenges is an important aspect of compassionate care. So we're going to start this journey by first talking through a case. And so let's talk about Joan for a minute. Joan is a person with Alzheimer's disease that you're working with. You're providing care to her, helping her really with those activities of daily living to meet her daily needs. So doing things like, helping her with food, helping her with medications. But one of the other things that you're also helping her with is grooming and showering on a regular basis. And often when in your work with Joan, she's becoming very aggressive, very agitated when it's time for her to take a shower. In some situations, she might be throwing objects that are nearby at you as her caregiver. She might be yelling or screaming or even crying during this process. And so you as the caregiver, you really dread this part of her care because of these extreme behaviors that she's exhibiting. And it's become such a toll on you that you really dread it and don't even want to try and help her complete this, even though it's part of your job. So let's think through this for a minute. Your task with helping her with this particular activity on a regular basis, how would you currently handle that situation? I would like you to pause for a moment and reflect on how you might work with Joan with what you know about, providing care to her. So now that you've kind of jotted down those things that you would actually do with her now, I want to kind of reframe this and have you think about the care of Joan in a little bit of a different way. And taking a step back and thinking about those why behind the behaviors. I think sometimes in our work, we often tend to just try to get through those tasks that are unpleasant with persons we're providing care to. And sometimes from a compassionate standpoint, it's not always the best way to approach it. And then sometimes, because we're rushing to get this task done, we kind of largely ignore some of these larger things that are going on with the person, which is problematic. So I've created this acronym to help you every time you have a difficult or challenging situation to help you better think about, what are my next steps? How can I really deal with this in the moment? And so I've broken down the why to include what is causing the person's distress. Obviously we often have this overarching situation that happens with an individual. So we know, for example, with Joan, it's shower time. That's what's causing her stress, her distress. We can break that down a little bit further and think about all of those different tasks that go on as part of the shower and better identify or better pinpoint what's causing that true stress for her and create interventions to help with that, which brings us to the how. So how are we going to help this person? How are we going to alleviate this stress to better manage this challenging behavior? You want to think about strategies that really align with not only what is that actual thing that they're having a challenge with, but also with things that they might like or they might prefer. And then under the why, you're going to want to check in with yourself as the caregiver. It can be so stressful and frustrating when you're working with someone and they're very resistant to care, and they're becoming agitated or aggressive. And so we really want to take that step back and think about how our mood, how our emotional state is also impacting the care that we're providing, and think about those areas as well. And so really thinking about and understanding the why behind behaviors is an important and critical aspect of compassionate care. So let's take Joan. I want you to pause the video and jot down a couple of things, thinking through the why model, how you might approach care differently, thinking about the what, what's going on with Joan, what are those exact things that are causing her stress, how can you intervene, how can you best help her, and then yourself. What's your emotional state? What can you do to really check in with yourself, take that deep breath, and really be able to engage in that compassionate care with Joan? So go ahead and pause the video now and think about how you might work with Joan in this situation using the why model. So let's start by tackling the what. So we know that broad overarching challenge that Joan is dealing with is shower time, and she's very resistant to care. Breaking that down further, it's important to kind of step back and think, okay, what are some of these contributing factors that are causing her not to want to shower? Could it be the temperature of the water? We know that persons with Alzheimer's disease and other types of dementia are often having issues related to temperature. So something that might feel fine for us as their caregiver, it might be too hot or too cold for that person. So really thinking about, what is it about this? Is it the water? Can we, put into place some things so we can uncover if that's the issue for the person? Is the water pressure too intense? For some individuals, we see that there's this either decrease in sensitivity or increase in sensitivity to touch. And so if the water pressure is too, intense, that could be jarring for the individual. It could be overwhelming for them. Additionally, even if it's not about the water touching them, maybe the water hitting the basin is creating that loud jarring noise for them that's overwhelming as well. That can be a contributing factor. We also have to think about, the whole shower process. A lot of showers in tubs are all one color, right? So for a person with Alzheimer's disease or another type of dementia, sometimes we find that their vision is often impaired. And when you add that with confusion or disorientation, for them, getting into the shower, it might look like they're stepping into a hole, essentially, right? Because they don't have that contrast and color within the shower. So thinking about, what's the environment look like for the individual? Could this be more disorienting for them? And that's why they're getting agitated. For some persons with various types of dementia, it might just be this general confusion that they're dealing with about what's the purpose of this? Why am I doing this? I don't remember, doing this every time. And so, adding to all of these other areas of it being an overwhelming kind of task for them, they could just be in general confused. So it's important for us to think, are we explaining the steps every time? Are we reminding them of, those prompts about what they need to do as part of the shower? All of that can have an impact for the person. And then there might be this general fear associated with showering. Maybe one time they had a bad experience. Maybe there was a fall or something else. And so they might not be able to explain to us that they're having that fear of the shower, but that could be part of it as well. So it's important to take a moment and reflect, especially in the situation with Joan, what is it exactly? Is it, that the temperature is she, fine getting undressed and stepping into the shower, but then the minute you turn on the water, that's when she's having issues? Is it that she doesn't even want to take the step in? All of these things can be really important to take a moment to reflect on. Now let's talk about the how. So what are some compassionate approaches that we can take with Joan to help alleviate the stress? Well, one is a very simple one, and it's involving Joan in the process. So as you're turning on the shower, let her feel the water. See what the temperature is like for her. She might only be able to give you a yes or a no, so you're kind of having to throw the spaghetti up against the wall to kind of figure out what's the right fit for her. But involving her in the process can be important. Making sure that you also understand that for a lot of individuals with Alzheimer's disease and other types of dementia, there's such a loss of independence. And so sometimes it's that piece of the puzzle that if we add that back in to some of these things that are part of their daily routine, it can really make the world of difference in terms of the care that they're receiving, but also in terms of better managing some of these behaviors. Really creating these short, clear instructions or explanations about what to expect. Even if you're having to do that every time, because we have to operate under the assumption that the person's not going to necessarily remember from one shower to the next what the steps are. The routine should really be that every time you're explaining, okay, we're going to do this first. Now we're going to do this. And keep it very short, keep it very clear, and don't give them a bunch of instructions all at once, because that can be overwhelming. You might also consider modifications to the environment. If the person doesn't, want to get in the shower immediately, it could be that they're having some of these vision related issues that they can't explain to you. So when they're, thinking they're about to step in the tub, if there's no contrast in color, once again, they might be feeling like they're going to step into like a hole or something like that. So important to consider those modifications, maybe painting different colors, so that, when the person steps in, they can see that contrast more easily. Additionally, using, instead of having the shower head that's over the top where that person might feel like they're getting pelted or they're feeling overwhelmed by that, a handheld shower wand can sometimes be helpful as well, because it's typically those are more gentle. You don't always get the noise of the water hitting the basin. That can be overwhelming for some individuals as well. And then, it's also important to think of ways to incorporate relaxing techniques right there on the spot. So, for example, I used to work as a caregiver to a person who, they were fine with all these other aspects of the showering process, but they would get really stressed out. Just the thought of, having to have somebody help them do this, because typically this is something we do independently. And so that's where his anger and his aggression was coming from every time we would try to work with him as staff to give him a shower. And so what we ended up doing was playing music in the background, making it fun. In some situations we even used essential oils to really help with the smell of the space, to create that really relaxing environment for him. So think about trying some of these small changes to the routine. And sometimes it's a trial and error process. So trying one thing and seeing if that works with the individual, then moving on to the next kind of idea. But it's important to, going back to the what, do that thorough assessment of what's really going on with the person, what's causing them not to want to shower. And then you, as the caregiver, really thinking about making sure you're engaging in regular self-care. Again, this is a very daunting responsibility, providing care to another person. So sometimes you're going to be frustrated. Sometimes you're going to be challenged by these behaviors that the person is exhibiting. So it's important to remember that even if you don't say you're frustrated, a person with Alzheimer's disease and other types of dementias can still pick up on that, right? Because we typically, when we're frustrated, we're rushed. We can sometimes be very abrupt in our communication to individuals. So thinking about how you're presenting the situation to the person as well. Really thinking about in the moment, just doing some quick breathing exercises with yourself internally, really checking in with yourself can really be helpful in terms of providing that compassionate care to the individual. Now that we've had the chance to walk through a case example of how you might use compassionate care with a person with Alzheimer's disease or another type of dementia, I'd like you to pause and reflect on how you might change the way that you provide care using this model. Really thinking about some of those situations or daily tasks that you're engaged in and working with a person with Alzheimer's disease, and really thinking about those ways in which you can elevate that care to not only provide for those activities of daily living with them, but also attend to those behavioral health and emotional needs. So now let's walk through another example together, just to really highlight how you can use this why model on dealing with some of these challenging behaviors. So let's meet Sophie. You're working with Sophie, really working just much like Miss Joan, working to provide care to meet her daily needs. Miss Sophie's really starting to exhibit some significant agitation and discomfort anytime she's in a crowded space, whether that be the facility that you're working in their communal dining area, or during group activities that she's scheduled to be part of during the day. And over time, her agitation has become increasingly problematic and distressing for staff, but also for Sophie as well. She's starting to act out towards not just the staff who are working with her, but also around the other residents who are part of those various activities as well. So this is really a challenging situation. Her agitation is really triggered by these crowded spaces. She seems to become very overwhelmed and disoriented anytime she's put into a group situation. She becomes outwardly very anxious, starts fidgeting. Sometimes she might pace when she's in that crowded space or crowded area or in that group setting. She also exhibits a lot of verbal expressions of frustration and discomfort. Sometimes she's shouting. And so, that's becoming problematic for those around her as well, because it's quite alarming. She's also showed some physical resistance during meal times because she doesn't want to go to eat with everyone else in the common area. And this has resulted in some weight loss and concerns about her nutritional intake. So all of these things related to her emotional state have really taken an impact on her physical health as well. During a recent medical evaluation, there were no signs of any acute medical issues contributing to her agitation. So her medications were reviewed. She was checked for things like infection that she might be dealing with that could cause her not to feel well and be exhibiting agitation. So the staff, including yourself who are working with her, are very alarmed by this. And as I mentioned earlier, this is something that is continuously becoming worse and her and the way in which her agitation is manifesting is starting to take a toll on everyone around her as well. So with Sophie, let's take a moment to pause and think about the why behind the behaviors. Think through the what, the how, yourself as the caregiver. Let's reflect on that and think about how you might use this model to kind of address some of these issues that are going on with Sophie. So pause for a couple of minutes, jot down your responses to this, and then follow along with the rest of this module. So when we start thinking about the what behind some of these issues that Sophie's dealing with, we really need to, really identify that we know first and foremost that the group settings are really what's causing this issue for her. She doesn't really have this when she's alone in her own room, or when she's working one-on-one with staff, or even engaging with other residents at the facility one-on-one. So we need to look at a couple of things. Is she becoming overstimulated by the group activities? Crowded or noisy environments can be very overwhelming for persons with Alzheimer's disease and other types of dementia. It can lead to this greater sensory overload, which can, either exacerbates or contributes to that agitation they're feeling. Also, for some persons with Alzheimer's disease and related dementias, the presence of multiple people in a room all talking at the same time, and all the background noise can be very disorienting for them. It's hard for them to keep track of the conversation, which overstimulates them. We do know that some persons with Alzheimer's disease also have those communication challenges that we've already addressed earlier in this module. We know that, it can the disease can impair the individual's ability to understand or express themselves really effectively. So in group situations, what we often find is that the person might not be able to follow the conversation, or they might be trying to contribute to the conversation, which is very natural, and no one around them is understanding quite what they're talking about or what they're trying to say. So this can lead to further frustration and agitation because they're in a group setting, but they're not really able to engage in a meaningful way. Also, unfamiliar faces can be, a problem for some persons with Alzheimer's disease. People they don't recognize can be distressing for the individual, especially if they're greeted by that person as though they might know them. They might feel anxious or threatened in the presence of unfamiliar faces. In Sophie's case, she's living in a facility where she might encounter these people every day, but she's not necessarily recognizing or remembering them. And so she's perceiving them as a stranger or a threat. Loss of routine can also be a factor that we need to consider in these types of situations. Changes in routine or unexpected disruptions to daily schedules can be very unsettling for persons with Alzheimer's disease and related dementias. What happens in group settings, a lot of times we're introducing new activities or interactions that really take them out of that normal routine that they're used to, or that established routine that they're used to. And so that disruption is very problematic because they don't know what to expect. So they become anxious and overwhelmed as a result. For some individuals, and so this could be the case for Sophie, really that discomfort due to whatever the seating arrangement is, maybe the chairs are not necessarily comfortable or not meeting that person's needs, or room temperature. A lot of times when you get a lot of individuals in a room, the room temperature goes up. So people might feel too warm. And so that can be a contributing factor as well that can lead to agitation. Additionally, outside of just that physical discomfort, for some individuals, it might be that lack of personal space, especially if it's a crowded group event. Maybe it's an art activity that the group is doing that day, where people are kind of moving around, gathering the materials that they need in order to do the activity, or other residents might be, infringing on that person's personal space, and that can be very distressing and lead to those feelings of discomfort and insecurity in their surroundings. So all of these are things that with Sophie, we need to really take into consideration to try and figure out, what exactly here is going on. So a couple of things that we can try is making sure that from the house standpoint, thinking about reducing that sensory overload. If possible, minimize the noise, check the lighting in the room if it's too bright, or in some situations, if it's not bright enough, that person can be, very overwhelmed by, everything going on. Remove distracting stimuli in the environment as well. So if there's a lot of loud music playing in the background or a TV on in the background, making sure we eliminate that, just to decrease that person's stress, and make it a more calming environment. Same being said, create a calm and familiar environment. We want to make sure that, that space that person is going to is comfortable, that it's welcoming, that it's familiar to them. So making sure that, we don't rearrange the room every day, for example, especially if it's a group activity and that person's going, to that same space over and over again. Let's try to keep it set up in a similar way. We want to maintain a structured and predictable environment for the person, create a routine around whatever that group interaction is going to be. So if it's going to dinner, for example, in the communal area, making sure there's a routine involved, whether it be, a specific staff walking to that person to the dinner table, helping them sit in the same space every time, maybe near or close proximity to others, the same people every day, can really help. It's also really important to tailor any activities, especially if it's a group activity, to what matters most to that person, to their individual preferences and abilities. So depending on what the situation is, really trying to figure out, okay, if it's, always the art group or activity of the week that this person's having an outburst related to, maybe art is just not for them. Or if it's the exercise class, for example, maybe that's just not something that they're interested in. So making sure that we tailor those activities if a person's really struggling with group environments, to kind of figure out, okay, what's working best for them? Is this just also not something they're interested in doing? Provide choices to the individual, offer options whenever possible. Sometimes when a person's overwhelmed, some of that can also be due to that loss of that feeling of they've lost control or autonomy in the situation. And so they're constantly being told, oh, you have to go to this group now, or oh, now it's time for dinner. Think about ways in which you can even provide small options or choices to the person so they have some say in the care that's being provided to them. We really want to focus on using positive reinforcement. So when things are going really well with the individual, making sure we communicate that to them in very short, simple, and concise language can be really helpful as well, and can also reduce that anxiety that they might be feeling and encouraging them to participate in the event. As I mentioned earlier, clear and simple language. We want to make sure we're speaking slowly, speaking clearly, using short sentences. Sometimes in group settings, we're trying to give, as caregivers, we're trying to give instructions to a number of different people all at the same time. And so that can sometimes be confusing for the person too, especially if we're talking to multiple people at one time. So making sure you focus on that individual person and their needs can also be helpful. Offering them visual cues in addition to whatever it is that you're talking about. So gestures, pictures, a combination of both, written words and pictures can be helpful in group environments. And then last but not least, really making sure you as the caregiver are remaining patient and listening to the needs of that individual. Sometimes people get overwhelmed and they just kind of need a moment to take a break. So if you're noticing that with a person like Sophie that you're taking care of, it's okay to pause and have them walk away from the group for a while. Making sure that we're really providing that opportunity for them to engage, but that if they are getting overwhelmed, that we can figure out other options with them. And then, as it relates to you as the caregiver, really thinking about how you're feeling, when you've got working with a resident and you've got a number of different individuals around you all at one time that you're trying to really help and provide care to, checking in with yourself. Are you feeling upset about the situation? Are you feeling frustrated? Are you feeling overwhelmed? Because all of those feelings can be very much adding to that person's experience, whether you're aware of them or not. And really making sure you're taking a deep breath. Maybe in some situations, if you're working with a number of different staff, you have the opportunity to maybe walk away yourself for a moment and just really check in and see how you're responding to that person who's showing agitation or aggression. The other thing I would like to add as well is that if you've got a resident in particular that you're working with who's really struggling in terms of the communal aspect of eating, maybe thinking about what are some other options for them if it's too overwhelming for them to eat in the communal area. Is there a quieter space there where they can go and sit? Or could they, invite one or two people that they feel comfortable with over to one table to sit and to share time together. So really trying to explore what those options look like for the individual can be really, really important and really help in terms of really, creating that compassionate space for them. Another important aspect of compassionate caregiving, and also in terms of really just thinking through person-centered care for persons with Alzheimer's disease and related dementias, is understanding what matters most to the person that you're working with. This can really help inform not only the care that you're providing, but also thinking about that compassionate communication aspect. And once again, developing plans for persons you're working with that are very person-centered and tailored to meet their unique needs, their values, and their preferences. Largely, as caregivers, we often get very worked up about providing care that's appropriate for the individual. We're largely thinking about all of those different things that an individual might need in their day-to-day life to be successful, so to speak. So things like those basic care components, those activities of daily living, things like, making sure they take their medication, make sure they're safe, make sure that they're getting sleep, make sure they're eating, making sure that they're getting those very basic needs met. Whereas a lot of times with persons with Alzheimer's disease and related dementias are concerned, it's not about those things. They don't necessarily are able to prioritize in that way any longer. So some of those basic care needs for them are no longer a priority. And sometimes what happens is we see this conflict between what we as caregivers want or need to do for that individual versus what they want to do. And so sometimes we have to kind of negotiate or figure out how we balance this a little bit more. So we're not just doing those basic care things, but we're also involving the person with Alzheimer's disease in some activities that they really enjoy, that they value, they prefer to do, to really give them that, overall sense of well-being, that sense of feeling like that they are able to still do some of these things as long as they still enjoy them. So really a lot of things when we talk about compassionate care as well, I like to talk about quote unquote choosing your battles. And sometimes that means that, we have individuals that we might be working with where, on that day, they might not want to shower, right? And there's none of these strategies that we've talked about in general are working, and they would rather go and sit and, play the piano if they're still able to do that, or take a walk with you. And so sometimes we have to figure out, okay, maybe that's okay right now in the moment because this person really wants this, and it's a meaningful, engaging activity for them. So sometimes we have to take that step back in our caregiving experience and figure out how we're going to balance this and how we're able to infuse some of those activities that that person still enjoys into their daily routine, so they're able to get that fulfillment that they need. And largely this also, when we start talking about values and preferences, we really want to also focus on understanding what matters most to that person we're providing care to. And a lot of times our individuals that we're working with Alzheimer's disease and other types of dementias aren't always able to communicate those things to us. So we sort of have to observe, or, going back to throwing the spaghetti up against the wall and seeing what sticks, trying out different activities with them, to see what's meaningful for them, to see what they're interested in. Making sure that we're really not just using communication from the standpoint of trying to talk and engage with a person verbally, but also observing them, and seeing what, sparks their interest, to better understand what matters most to them. And, even asking them very simple questions to involve them in the choices for the day, the activities that they're going to engage in, can be really helpful, even if it's a simple yes or no. For example, instead of asking them more of a broad question of what would you like to do today, instead ask them, would you like to go for a walk? Would you like to go sit in the garden? Would you like to play cards? Give them a couple of different options and see which one that they're able to respond to, versus again asking them that, kind of over that question that could be overwhelming for them, which is something to the effect of, what would you like to do today? So really thinking about, prioritizing what matters most, making sure that those plans of care that you're doing with individuals with Alzheimer's disease really reflect what matters most to them. And again, sometimes that can be difficult and challenging due to those communication barriers that individuals have. If they're still able to communicate with you effectively, I say go ahead and try to have those conversations with them. But outside of that, if you're really struggling, break it down, give them choices, give them options, and try to figure out how you can incorporate that into that basic care that they really require from you in the work that you're doing. So to conclude today's module, let's do a quick recap of some of the things that we covered. I really want to encourage you to spend some time once you've completed this module, really thinking about how you're going to incorporate some of this new knowledge into the practice of providing care to persons with Alzheimer's disease and related dementias. Now, in this module, we really focused on some of the very basics that you might need to know about dementia and Alzheimer's disease as a whole, really taking that broad overview to better understanding the condition, understanding the unique needs of individuals with this particular condition, and what you might need to know to provide care. We also discussed some of the behavioral health and emotional needs of persons with Alzheimer's disease and related dementias, really thinking through, what are some of those things like anxiety, depression, and how those sometimes manifest as very challenging behaviors for those of us who are providing care to individuals, and taking that deeper dive into a couple of cases to really help you better understand some of those unique needs. We focused on what is compassionate care, really thinking about, the fact that we need to recognize the suffering that the person's going through, really thinking about what care can look like in order to not just provide effective care to the individual, but really compassionate care to help alleviate that suffering that the person might be dealing with. We covered the why model behind behaviors. So really thinking through what's causing the person's distress when they're exhibiting a challenging behavior, really identifying how to help that individual. What are some of those compassionate strategies that really align with what's going on with the individual? Really also thinking about strategies that align with things that that person likes or prefers, really thinking about what matters most to them. And then last but not least, that emphasis on checking in with yourself as the caregiver, really trying to better understand how your emotional status, how you are responding to the situation can really really be compassionate for the individual, or if you've got a lot of additional stress or you're feeling frustrated, how that can really cause that ripple effect with the individual and cause further challenges in providing care. So really thinking about you as the caregiver and some of those unique things that might be going on with you. We also covered thinking about what matters most to the individual, really considering all of those unique values and preferences that a person with Alzheimer's disease might have, and how do we better incorporate that into our work that we're doing from a compassionate standpoint within the caregiving experience. And then moving forward in our subsequent modules, we're going to be focusing on compassionate communication, really thinking about some of those challenges that individuals with Alzheimer's disease and related dementias often deal with in terms of just providing that overall care, but really thinking through how that can help in terms of the overall experience. We're going to focus on 3 primary challenging behaviors in 3 separate sessions. We're going to focus on repetitive behaviors, anger, aggression, agitation, and hallucinations and delusions. Often we see that individuals with Alzheimer's disease and related dementias really struggle in terms of some of that anxiety they're feeling, that depression they might be feeling, that general frustration that they might be feeling about not being able to communicate. So really thinking about how those behaviors manifest, what could be contributing factors to those behaviors happening with individuals, and how we as caregivers can really think through some of those various aspects of care to really prevent and manage those behaviors as they come up. And then last but not least, we're going to spend some time talking about self-care strategies for you as the caregiver, really focusing on what you need in order to fill your cup, so to speak, and really be able to be the best caregiver possible from a compassionate care standpoint. So that's the remaining sessions that we will do as part of the series on compassionate caregiving. I would like you to take a moment at the end of this module to really reflect on how some of these things we've already talked about you can start putting into place in the caregiving experience. So at the end of the video, I encourage you to pause for a moment, jot down some of these lessons that you've learned in terms of providing more compassionate care, and really think about those as we move forward into the next series of trainings.